Now, South African healthcare leader and commentator Dr. Kgosi Letlape is the president of the Health Professions Council of South Africa. He joins us now via Skype. Thanks so much indeed for joining us. Always a pleasure to talk to you. You blasted the public earlier, saying that its behaviour is not helping in the fight against COVID-19. Take us through your thinking.
Good evening to you and the listeners and the viewers. I guess some listen. I guess my essence is that people, as a community, we need to understand that stopping HIV is mainly a community response. It's about the hygiene measures, physical distancing, and to listening to what is pronounced. And if we comply, the lockdowns levels will come down. But the objective, as has been said many times before, is to flatten the curve. But we flatten the curve with the behavior in the community and with what happens in our societies. We don't flatten the curve at the hospital.
All right, but society is what it is, and you almost have, as authorities, have to factor in that there's going to be a certain level of delinquency. Isn't that how you manage society?
I think we got to do better. We got to change our paradigm to being responsible citizens. There are countries in Europe where there's never been a hard lockdown because the rule of law, but more importantly, consideration for each other is of the utmost. So people do the right thing so that they do not inconvenience others. We've always spoken about Ubuntu. It's now time to practice Ubuntu. The key issue is let's put others first. Let's protect other people. And there should be no room for delinquency on the issue of protecting one another.
All right, so as we look at the figures in the Eastern Cape and the Western Cape, they're the only ones that had triple-digit new cases overnight. What does that tell you? Is this something that concerns you, sort of looking from a distance?
Yes, it concerns me. But coming from a scientific background, we need to ensure that those that are responsible in those provinces are able to analyze why that is occurring. We need to be able to compare what is the penetration of testing in those areas. Are they testing much better or more successfully than the other provinces? But more importantly for me, we got to look at it as a hotspot in South Africa rather than the Eastern Cape, and begin to say, what are the lessons to learn from those hotspots? What do we do if the hotspot is now in Gauteng or is in Mpumalanga? And it should be about South Africans working together. If the hotspot needs more resources, let's have the national command and the national health being able to assess the needs of the hotspot so that we divert more support to where it is needed.
All right, so the Western Cape, we know, are testing phenomenally. I mean, I believe as much as 60% of all the tests in the country have come out just from the Western Cape. And this begs the question then, how is it that they're able to get so many more tests done than the other 8 provinces?
But that's exactly my point, that they should be able to share their winning formula for expanding testing so that other provinces can learn from them. It cannot be that we compete with each other. It has to be that we learn from each other. It might be simple things that they do, better preparedness of the societies, better engagement, better education, so more people come forward. You may find that it's not that there aren't resources in other provinces, but the education of the public might not be as good, so people are scared to come forward and test. So we need to be able to have the social scientists being able to analyze what the reasons are, so that it could then inform how to improve our efforts at testing in other parts of South Africa.
In the early part of lockdown and trying to manage this pandemic, the government was lauded for the way that they'd approached the pandemic in South Africa. But people are starting to become impatient, and questions are being asked about some of the rules, which people say perhaps are a bit draconian. As a person who understands science and medicine, what's your take on the continued approach that government is taking in trying to manage this pandemic?
I think COVID-19 is a new disease, and there is no one that is expert at this new disease. And we need to commend the government for the actions that they've taken so far. And I think part of where we're lacking is to support each other in these difficult times. And some of the issues might be, what is it that we should be doing to support one another whilst we're still in lockdown? How do we ensure that the morale doesn't go down? How do we ensure that people understand that we're doing the right thing with the right results? And we should not be hard on ourselves, because notwithstanding poor compliance from other citizens, compliance has generally been good, and we've been able to flatten the curve. We should always remember that the effort had always been, let's protect the hospitals. Our hospitals are not overwhelmed yet, so our efforts are not fruitless. But as Professor Karime said, we should have the long game, understand that it's going to get worse before it gets better. So what we have done is to ensure that the stress on our hospitals can be on a slowly progressive basis rather than on an acute, massive need for hospitalization. So we should not be hard on ourselves, but we should also be mindful of the fact that we need to come up with strategies for being in lockdown. And I was heartened to see that South African Depression and Anxiety Group is talking about managing the anxiety in our communities. We need to ensure that those issues of the mental aspects of lockdown are not only available to the affluent communities, but are available to all South Africans. We should be engaging more social workers. I remember a week ago, a number was muted that 9,000 social workers would be employed. There's a need for that. There's a need for engagement and emotional and mental support of the public under lockdown, so that we do not end up resenting what is being done. Let's keep our eyes on the prize, which is to control COVID-19.
All right. So, I mean, it's interesting to watch what's happening in other countries, because they're so far ahead of us in terms of this curve, and perhaps there's lessons to be learned. The WHO Director General has warned about the easing of these lockdowns, and Germany, South Korea are almost proof of what can happen, because they're seeing reinfections taking place. What can South Africa learn from what these other countries have gone through about the way we should manage our lockdowns and easing thereof?
I think part of the major difference between the psyche of the countries that you've mentioned is that they emphasize responsibility as much as they emphasize the rights of the person. In South Africa, it's the right in exclusion to responsibility. Now, unfortunately, a challenge like COVID-19 requires citizens to sacrifice their right, but to up their game in terms of responsibility and being your brother or sister's keeper. Finding it not difficult to do the right thing. Yeah. Understanding the benefits of the rights of a, rather than individual selfishness that we express as right.
And it must be concerning. We're seeing people, now that they're wearing masks, seem to think that the social distancing doesn't need to be important anymore.
And that's precisely the problem, that part of what is lacking is an ability. As much as we give people the numbers, we should also be coming up with messages to encourage the hygiene, the social distancing. We should be doing innovative things. For example, I've seen on news the breweries pouring beer down the drain. And we still know that there are communities that are challenged with access to water. We've seen in other countries alcohol producing companies switching to producing sanitizers during the COVID pandemic. And I wonder, what is the content, the water content of beer, and whether their industrial plants would not have been used to produce water, so that are areas where we've seen that people have no access to water would have been given water. So that we're doing things that are proactive. We become responsible. We think ahead in terms of, we shouldn't be fatigued by doing the right thing. But I guess, given our history, where it's been about rights more than responsibilities, it's not been about, this is a pair that goes together. If we want our rights, we should carry our weight and share of responsibility.
All right, and perhaps, again, observing the trends in other countries and assessing where we are, when do you think we'll hit the peak? Because, as you said, it's going to get worse before it gets better. When are we likely to hit the peak in South Africa?
I think that's information that has been given to us by the ministerial task team. Professor Karim, a few days ago or a week ago, outlined that we'll probably get into our peaks around August, September. We must remember that the first areas to be hit by COVID-19 were in the Northern Hemisphere, and it was during their winter. It came into us as we were getting out of summer, getting into our autumn. And as they say in Game of Thrones, winter is coming.
Right.
So we just need to be mindful of the fact that in terms of seasons, the worst is still tough. And what we should use this time for is to say to ourselves, we've managed to ensure that we lessen the peak, we become prepared, not just in hospitals, but in society, about getting to those issues. There are many issues that we are not discussing. That's once you get to those numbers, there'll be challenges in terms of those that would be dying. There'll be challenges in terms of funerals. And we need to be socially preparing ourselves for that. And people need to understand that mass gatherings are off the charts for a long haul.
All right. Dr. Kgosi Letlape, we're going to have to leave it there. Thank you so much. Your insights are always greatly appreciated by us at the SABC News Channel. Thanks so much.
Thank you very much for the opportunity. And let's hang in there. Winter is coming, but let's remember, it's in our hand. Hygiene, physical distancing, cleaning of surfaces. Have the physical distance and still keep the social interactions. Let's use technology to keep in touch.